In the Cape Town suburb of Bonteheuwel, Flori Schrikker lives with the devastating consequences of neglecting her health. She too is a type 2 diabetic.
It is an adjustment, but what can you do? You've got to do it.
It started with a finger, then 3 toes, and finally, in 2011, an infection on her foot threatened her life. The doctor gave her a stark choice.
Either your foot or your life. So what are you going to choose, your life or your foot?
The 64-year-old developed high blood sugar levels when she was pregnant with her 3rd child. The condition, called gestational diabetes, often disappears after pregnancy, but means women are more likely to develop type 2 diabetes later on in life. Flori confesses she was in denial about the disease for years.
I didn't want anybody to know that I was a diabetic, so I ate everything that the next person ate. I never used to say no for a Coke, because I was very fond of a Coke. Of course, we had skipped, no?
Flori realizes things could have been very different had she made the right food choices when she was younger.
If I had to change my lifestyle that time already, I wouldn't have been this far where I am today.
Through managing her diet, Flori is finally controlling her diabetes and has some simple advice for others.
I've tried not to drink a lot of sugar. Don't eat a lot of starch. I've changed from white bread to brown bread, and I've tried to eat everything moderately.
A passionate cook, she has co-written 2 cookbooks and is working on a 3rd one, specifically for diabetics. She hopes others will learn from her mistakes.
I will always tell people, if you're a diabetic, just look at me. If they say you must take your tablets or you must take your medication, take it and try to eat whatever you are used to. Try to eat it moderately.
Although eating healthy food can minimize the chances of diabetes developing, for the majority of South Africans, healthy options are not affordable. Makosi Ngala is a mother of 2 who lives in Umlazi, outside Durban. She was just 33 when she discovered she had type 2 diabetes, but has managed to avoid serious complications thanks to her early diagnosis and a good diet.
You must have once at least a vegetable on your plate every day.
As an unemployed head of a household of 6, she doesn't always have the money for fresh vegetables.
I will try to get that healthy food for me, but it's very expensive because I'm not working.
Many households like Makosi's struggle with the cost of healthy foods. But even on a tight budget, there's one thing experts say people should stop buying to improve their health.
The sugar-added beverages, the sweet things.
South Africa's love affair with sugary drinks is a major problem. Research from the University of Cape Town shows the average South African consumed 254 sugary fizzy drinks in 2010, compared with a global mean of 89. It's no wonder the country has the highest obesity rate in sub-Saharan Africa, with close to 40% of South African women thought to have dangerous levels of body fat. To help address the problem, government plans to introduce a sugary drinks tax. By raising the cost of the sweetest cool drinks, the state hopes to curb the rise in non-communicable diseases like diabetes. But diet is just one piece of the puzzle. Catching the disease earlier is another priority. Podiatrist Nikita Sahaju sees the results of late diagnosis every day.
You can actually smell infection from a mile away. And once you've done like 100 of these, you kind of know the smell. This is quite typical where you've got a callus, and it's really important that we cut, we clean, we excavate that wound and we dress it to allow the patient a good enough chance to heal, which is already limited. Okay, so usually when we've got an infection,
many of her patients only realize they have diabetes when they get an ulcer.
The symptoms of diabetes are the symptoms of life. You get tired all the time, you go to the toilet frequently, you wake up with night sweats. Sometimes life is just stressful. You just think, I'm stressed, I'm tired, and these things get masked.
Left untreated, diabetic foot ulcers such as these lead to amputations. This kind of treatment isn't widely available at public hospitals, and few South Africans can afford to pay for it.
So a shoe like this for a diabetic patient would cost something like 6,000 rands. What's so important about the shoe is that it's got these sort of flexible uppers. It's completely adjustable to cater for the structural changes that will happen in a diabetic patient. It's inevitable. They've got these soft soles where it absorbs a lot of the shock. Seams are really important. Something as simple as a seam could cause an ulcer from an abrasion for a diabetic patient. But a lot of people cannot afford 6,000 rand.
Dr. Sahaju is among those who believe investing in better screening and earlier treatment will save lives and money, as late-stage complications and amputations may be far more costly in the long run, both to the patient and the healthcare system.
And there's still other considerations, like these people who have had their feet amputated now go on social grants. You know, now their family has lost one of their breadwinners. The quality of life is severely reduced. A multidisciplinary team can reduce amputations by 85%. That we know.
Experts believe the earlier the diagnosis, the better, and are urging South Africans to take responsibility.
Go and have a simple test done at your local doctor, simple, cheap test, and have it done regularly to make sure, especially if you've got a family history of diabetes or you lead a high-risk lifestyle, low exercise, lots of takeaway foods and commercial foods that we all eat.
We're only likely to succeed in the fight if we tackle all the different elements together.
We need to promote healthy living from childhood onwards. And therefore, if we want to be successful, I don't think it is in the hands of the healthcare providers only. We need to involve government, we need to involve society, and we also need to involve the food industry. And we all need to work together to sort of limit the unnecessary intake of, as I've said, calorie-dense, low nutritional value foods that's consumed.
When we return,
for me, it was more challenging dealing and accepting that I have this condition.